The prevention of mother-to-child HIV transmission (MTCT) is a global public health priority, aiming to prevent HIV transmission from an HIV-positive mother to her child during pregnancy, childbirth, and breastfeeding. Post-exposure prophylaxis (PEP) for pregnant women has emerged as a crucial tool in this effort, offering a lifeline to prevent HIV infection in both the mother and the child. Understanding the risks of MTCT and the role of PEP. Mother-to-child HIV transmission can occur during pregnancy, childbirth, or breastfeeding. Without appropriate interventions, the risk of MTCT can range from 15% to 45%. However, with effective interventions, such as antiretroviral therapy, ART, and PEP, the risk of MTCT can be reduced to below 1%. PEP, a short-term course of antiretroviral medication, is particularly valuable for pregnant women who have experienced a potential HIV exposure during or after pregnancy. When initiated within 72 hours of exposure, PEP can significantly reduce the risk of HIV infection in both the mother and the child. PEP HIV prevention guidelines for pregnant women. The CDC and WHO have established comprehensive guidelines for PEP HIV prevention in pregnant women, providing evidence-based recommendations for healthcare providers and pregnant women at risk of HIV exposure. These guidelines outline the eligibility criteria for PEP, the recommended medication regimens, the duration of PEP treatment, and the importance of adherence and follow-up testing. Eligibility criteria for PEP HIV prevention in pregnant women. PEP is recommended for pregnant women who have had a potential exposure to HIV within the past 72 hours. This includes unprotected sex with an HIV-positive person, sharing needles or other drug-injecting equipment with an HIV-positive person, occupational exposure to HIV-infected blood or body fluids. In addition to these criteria, PEP may be recommended for pregnant women who are unaware of their HIV status or who have tested negative for HIV but have an ongoing high risk of HIV exposure. Recommended PEP HIV prevention medication regimens for pregnant women. The CDC and WHO recommend two primary PEP medication regimens for pregnant women. Truvada, emtricitabine, tenofovir disoproxil fumarate, taken once daily. Atripla, efavirenz, emtricitabine, tenofovir disoproxil fumarate, taken once daily. The choice of regimen depends on individual factors, such as potential drug interactions, medical history, access to medication, and the woman's trimester of pregnancy. Duration of PEP treatment and follow-up testing for pregnant women. The recommended duration of PEP treatment for pregnant women is 28 days, starting within 72 hours of potential exposure. However, the duration may be adjusted based on individual circumstances and the type of exposure. Regular HIV testing, both during and after PEP treatment, is essential for pregnant women to monitor for potential infection and ensure the effectiveness of PEP. Additionally, pregnant women who are HIV positive should continue ART to prevent MTCT throughout pregnancy, childbirth, and breastfeeding. Adherence and follow-up care, cornerstones of effective PEP for pregnant women. Adherence, the consistent and correct use of PEP medication, is crucial for its effectiveness in preventing HIV infection in both the mother and the child. Missing doses or taking medication at the wrong time can significantly reduce the protective effect of PEP. Regular follow-up visits with healthcare providers are particularly important for pregnant women on PEP to monitor adherence, manage potential side effects, address any concerns related to HIV exposure, and ensure optimal maternal and child health outcomes. Empowering pregnant women through PEP HIV prevention. PEP HIV prevention offers a powerful tool to prevent HIV infection in pregnant women following potential exposure, safeguarding both maternal and child health. By understanding the PEP HIV prevention guidelines, eligibility criteria, recommended medication regimens, duration of treatment, and the importance of adherence and follow-up care, pregnant women at risk of HIV exposure can make informed decisions about their health and protect